Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. November is National Rural Health Awareness Month, but the issue of rural health and addressing inequities in access to care for rural populations is a year-round focus, both at IDPH and with other organizations. Joining us to discuss these important issues, Kristen Nolen, Section Chief for the Center for Rural Health at IDPH, and Alan Morgan, Chief Executive Officer of the National Rural Health Association. Thank you both for being here. I want to dive right in, starting with Kristen, to begin with you to explain the mission of the Center for Rural Health and why it's necessary to have a specific focus on rural health issues in Illinois.
Hello. The Center for Rural Health was formed in 1989 on the recommendation of the Governor's Rural Health Task Force. The goal of the center is to improve access to primary health care in rural and underserved areas of Illinois and to encourage community involvement in issues affecting the health of our rural neighbors. A specific focus on rural health issues in Illinois is necessary due to unique challenges that significant the health and well-being of residents in these areas. Challenges like higher rates of chronic conditions, less access to healthcare services, long travel times to points of care, higher poverty rates, lack of insurance, limited economic opportunities, which all affects access to nutritious foods and stable housing, among many other issues.
And we're going to delve into all of those issues over the course of this discussion here. Of course, this is an issue that not only impacts Illinois, but also many other states and communities across the nation. So it's an honor to welcome Alan Morgan, CEO of the National Rural Health Association. Alan, please tell us about your organization, its mission and goals.
Well, thanks, Jim. I appreciate the opportunity to join with you today and talk about my favorite topic, rural health. The National Rural Health Association is a membership organization, and if you care about rural communities, there's a home for you within the NRHA. What we do is we identify best practices. We share those best practices for hope of replication. We want to make sure that all rural communities have access to high-quality health care. Our membership includes clinicians, nurses, people that oversee rural health programs, researchers. But again, honestly, if you're a leader in a small town, you care about your town's health, there's a home for you in NRHA.
So let's get into some of these issues that you were both so focused on, starting with healthcare inequities in rural areas. We have what is known as healthcare deserts in many rural areas in Illinois and other parts of the country. So I'd like each of you to weigh in on why do these deserts exist and what does that mean for the people who live in those areas? Kristen, let's begin with you.
Sure. Healthcare deserts exist primarily due to a shortage of healthcare facilities, providers, and other resources in certain geographic areas. Sometimes these shortages are driven by economic factors, demographic challenges, and even infrastructure limitations. Rural and low-income urban areas are especially vulnerable as these regions struggle to attract healthcare providers and may lack the financial resources to support hospitals and clinics.
And so, Alan, what does that translate to in terms of the health of people living in these rural areas? Do we see certain conditions and issues that disproportionately affect them?
Oh, unfortunately, 100%. I'm going to build a little bit on what Kristen shared with you. Over the last decade, we've seen 151 rural hospitals close. These are communities now that do no longer have access to 24/7 emergency room service. And it's important to note, wherever you live, you want to be at least half an hour from that 24/7 emergency room service. That's so very important. When we talk about healthcare deserts in a rural context, and certainly among the people that are going to be listening to this broadcast, we're really talking about very necessary specialty care in many cases. Behavioral health specialists, access to behavioral health specialty and specialty care in a rural context is a real problem. And then you get to cardiovascular care, and I don't want to overlook just basic primary care. It's very important to note access to care determines your health status in many cases.
This seems like it could be something of a vicious circle. It may be hard to get doctors and hospitals and specialized treatment in areas that may be economically depressed. But if you can't get that care, that bad health could lead to even more economic issues, and it just seems like it's a spiral that would just keep on going.
Oh, it is. And one of the huge problems when you're talking about rural health in rural America, it really is a study of workforce shortages. And to your point, it is oftentimes difficult to attract and retain clinicians to rural communities. But I don't want to overlook the fact that in many cases, we're doing our education incorrectly. And I say that by oftentimes the kids are entering medical schools and nursing schools or upper income urban kids, and we train them in urban areas, and then we're dumbfounded. They don't want to practice in rural America. We really need to do a much better job of doing rural residency training programs, getting rural kids out there and making sure they know that they have a future there in those hometowns they love and want to live in.
So, Kristen, what programs does IDPH offer to increase the availability of healthcare professionals in these underserved areas?
The Center for Rural Health administers a number of workforce programs for students and graduates in health professions. We administer scholarship and loan repayment programs for health professionals who agree to work in those shortage areas. We coordinate the Conrad 30 J1 visa waiver program for Illinois, and we also support the federal National Health Service Corps programs, which they offer a variety of scholarship and loan repayment programs at the federal level to help alleviate the health professional shortage problem here in Illinois.
Alan, from your perspective, what's the importance of these programs, and what more can be done to increase the availability of healthcare services in rural areas?
Yeah, well, let me say I love everything that Kristen said. That is exactly the right way to be approaching it. She's doing everything right. Her office is doing everything right for that. I do want to stress again, it's so very important that communities grow their own as well, too. And take this opportunity to plug for clinics and hospitals, which you can get those high school kids in as an experience and show them that they can stay in their own communities and have a great future. I can't stress the importance of that enough. Now, that being said, it takes a federal-state partnership to make sure that we're addressing loan forgiveness and a lot of these other revenue economic issues that oftentimes become barriers.
You're listening to This is Public Health with the Illinois Department of Public Health. Our focus on rural health during this National Rural Health Awareness Month. And our guests are Kristen Nolen, Section Chief for the Center for Rural Health at IDPH, and Alan Morgan, Chief Executive Officer of the National Rural Health Association. My next question is pretty open-ended. I'd like each of you to weigh in about some of the other programs and services that are available to help people get the care they need, but also the health information and education that they need so they can make healthier choices. Kristen?
Well, Illinois offers several initiatives and programs to improve healthcare access for its rural populations. Some of those efforts include expanding telehealth services and then also investing in those loan for repayment and forgiveness programs to attract more healthcare providers to these areas. And for instance, Illinois has a nurse education scholarship program funded by nursing licensing fees, which are then used to reinvest in the education of the next generation of nurses who will serve Illinois. Another program funded by cannabis sales offers loan repayment to behavioral health providers. The state also supports education pathways to grow the health workforce from within rural areas, and also includes scholarships and targeted recruitment for health-related careers at high schools through our area health education centers and community colleges across Illinois. There's some other infrastructure development also, which plays a significant role in supporting rural health. The U.S. Department of Agriculture has invested millions in Illinois through programs that fund the construction and expansion of healthcare facilities in underserved regions. That funding is especially critical as it helps small towns build or upgrade hospitals, clinics, and other community facilities. When it comes to telemedicine, it's become increasingly vital as rural residents may be far from specialists or advanced care facilities, allowing those patients to receive consultations and ongoing care without long travel. So these efforts reflect Illinois' multifaceted approach, combining direct healthcare funding, education pathways, and community-based healthcare infrastructure to address the rural needs more comprehensively.
Alan, tell me a bit more about some of the programs that your organization supports, promotes, is involved in to address these issues.
Yeah, let me do this the easy way. And after this podcast, just remember the words rural health. Google, Yahoo, Bing, type in the words rural health. Our website is always one of the top 3 to 4 that pop up there. And from that site, you can easily navigate to many of the programs that Kristen referenced, including the ones at her own office as well, too. Loan forgiveness, huge. That's a huge issue. More information about rural residency programs, that's important as well, too. For us at the federal level, we want to make sure that we're having the federal government be great partners with local communities when it comes to ensuring access to care. And many times that has to do with having access to grant programs that can provide that funding to allow you to innovate and start up new programs throughout your community. So again, remember the words rural health, and that's a starting point to lead to a lot of these opportunities that we talked about.
I want to touch briefly on one other issue that definitely impacts the well-being of rural communities, and that's well and septic system safety. And while this doesn't fall directly under the Center for Rural Health at IDPH, it is, again, an important issue in these communities. So, Kristen, what do people need to know about this issue?
Overall, when you own a private well, you have a primary responsibility for testing and maintaining it. IDPH recommends regular testing for coliform bacteria and nitrates to ensure that your well water is safe to drink. Your local public health department is a great resource for any questions you may have about your well, and they can assist you with sampling and inspecting. It's also a good idea to test for metals and other contaminants if there are known sources nearby, and IDPH can help well owners identify those testing labs and interpret results on request.
And again, you can contact your local health department for more information. You can also reach out to the IDPH Environmental Health section for more information on that. But in the meantime, if people would like to know more about rural health in general or specific programs that we're doing both here at the state level, but also that is happening with the national organizations, I'd like each of you to let people know how to get in touch with you. So, Alan, again, you talked about this briefly, but how can people learn more about the work you're doing at NRHA?
Yeah, thanks for that again, Jim. And again, just remember the words rural health, Google, Yahoo, Bing. And from that website, you can see policy, you can see what programs are available, you can see grant opportunities, and more importantly, you can have the opportunity to network with other people across the country. We've talked about a lot of challenges that rural faces, but I don't want to shortchange the fact that innovation really happens in these rural communities when it comes to healthcare.
A really important point, and I'm glad you brought that up. Kristen, I know you also see this as well, the efforts that are happening in these rural communities and with local leaders there with the support of the Center for Rural Health. So how do people reach out to the Center for Rural Health at IDPH for more of that assistance?
Sure. Well, similarly to Alan, you could Google rural health and just put IDPH next to it, and you'll get a hit for our website, or we can be reached by email. Our general inbox is dph.crh@illinois.gov, or by phone, 217-782-1624.
Kristen Nolen, Section Chief for the Center for Rural Health at the Illinois Department of Public Health. Alan Morgan is the Chief Executive Officer of the National Rural Health Association. Again, thank you both for being here on this important discussion about rural health in Illinois and across America. Join us next time for another edition of This is Public Health with the Illinois Department of Public Health.